Hello, my name is Lillian Schmitz, and the date is May 10th of 2021. Today I'm doing a presentation on Addison's disease. So signs and symptoms of Addison's disease include extreme fatigue, hyperpigmentation, hypotension, and possible syncope, salt craving, hypoglycemia, GI symptoms including nausea, vomiting, and diarrhea, myalgia and arthralgia, alopecia of the body, and sexual dysfunction in women. So an Addisonian crisis is acute adrenal failure due to Addison's disease. It can be set off by stress, illness, or injury. And what happens here is someone doesn't have Addison's disease or they don't know they have it. And this crisis presents suddenly as severe weakness, confusion, pain in lumbar region and lower extremities, severe abdominal pain accompanied by vomiting and diarrhea, which leads to dehydration, reduced consciousness and delirium, hypotension, hyperkalemia, and hyponatremia. And again, this crisis is sudden. It is usually what happens is there's bleeding into the adrenal glands, and that's what will cause an Addisonian crisis. So diagnosis of Addison's disease include blood tests, which will test your blood for sodium, potassium, cortisol, and then also adrenocorticotropic hormone. It's kind of a mouthful, so it's abbreviated as ACTH. And now we see here we have an ACTH stimulation test. So that is another diagnosis tool used for Addison's disease. And what this does is it injects your body with ACTH, which should basically signal your adrenal glands to break or to release cortisol. So in this case, they test your cortisol levels before and after this test. Insulin-induced hypoglycemia test. So this is when they inject you with insulin, and this is more so to test if there is a pituitary dysfunction. So with this case, when they inject the insulin, it should signal the ACTH hormone to be released and cause cortisone or cortisol to be released as well from the adrenal glands. But in the normal person, glucose levels fall and cortisol levels increase. If we see something different, then it could be Addison's disease. So also CT scan or MRI, so those are used for imaging, and you're able to see tumors or inflammation of the adrenal glands or the pituitary gland. So causes of Addison's disease, so it results from damage to the adrenal glands, which leads to low levels of cortisol as well as aldosterone. There's two types. So the primary adrenal insufficiency, this affects the adrenal cortex. So that's the outer layer of the adrenal glands. And what happens here is it doesn't produce cortisol, so no cortisol is being produced. This can be affected by autoimmune disorders that are going to attack the adrenal gland tissue, thinking it's foreign, tuberculosis, or infection or metastasis of cancer to the adrenal glands. Secondary adrenal insufficiency, this is caused by this is an insufficiency in the pituitary gland releasing that ACTH. So common causes of this are pituitary tumors and corticosteroids. These are medications used to treat Addison's disease, and stopping them abruptly can cause symptoms and low cortisol levels. Treatments for Addison's disease include HRT, which is hormone replacement therapy. And this includes hydrocortisone, prednisone, or methylprednisolone. These are cortisone injections. Or we can use fludrocortisone acetate, and that is to help bring aldosterone. So that's an aldosterone therapy. Plenty of sodium in the diet is important, and corticosteroid injections. This can be the case if someone is taking an oral medication and throwing it up. Injections might be a better option. So my resources, I got my resources from Mayo Clinic, and that is my presentation. Thank you for listening.